was having problems from time to time of being able to go to the restroom. I went to the VA and I was given different medication to relax the prostate, the bladder, and so forth. And that seemed to resolve the issue. Last 5 years or so, it started getting worse. I was told I had an enlarged prostate, so I ended up infected, ended up in the emergency room. I ended up in ICU, so I was in the hospital for about a week. My urologist told me that there's something we got to do beyond what we've been doing, and I agreed with him. I looked at the laser procedure, I looked at Uroband, I looked at steam, and I thought, none of these sound like anything I'm interested in, because they're irreversible except for the Uroband. And I stumbled on prostate embolization. My consultation with Dr. Short. He said, tell me what you know about this one. I said, basically, you're going to go in and you're going to take a small catheter down to where the blood flow is fed to the prostate. You're going to insert these small microbeads, and they're going to slow down the flow of blood supply, and the prostate will shrink.
Right, so in essence, we're turning down the flow to the prostate. And much like if you turn down the flow to, say, a fruit tree, right, that fruit will start to shrivel up. Right? The same thing happens to the prostate. By blocking the arteries to the prostate will shrink. As a result of it shrinking, the urethra will open up and people are able to urinate more easily. Given the success that we had with Mr. Baker, it was a very satisfying procedure to do. The technical capability is here, the willingness is here, and I think we have the patience for it.
I'm very grateful that I had the procedure done.
Take in another breath, let it out, and hold your breath. Don't move, don't breathe.
The procedure takes a couple of hours. The patient will then be in recovery for a few more hours, and then we'll go home the same day.
I really didn't have much pain at all, to be honest. On the third day, I was able to pass a little bit, and I got all excited about that because I had not been able to do that. I can't remember when. Ever since then, I've been able to go just like everybody else.
In Mr. Baker's case, and in most cases, usually you see results within a couple of weeks. Maximum results are achieved at probably about 3 to 6 months. At that point, the prostate has shrunk all that it's going to shrink.
It's totally changed everything. I can go where I want to go. I don't have any restrictions. My emotional stability has gotten much, much better. My life is so much better now.